Thank you. New tonight, IU Health's peer substance abuse recovery program has helped 800 substance abuse victims get connected to the help they need after winding up in the ER. On World Mental Health Day, News 8's Travis Robinson spoke with the program workers about why the staff is so passionate. Travis?
Mike, recovery coaches say substance abuse disorder and mental health issues go hand in hand. And if people who are hitting rock bottom can get a push in the right direction, they can lead healthier lives both mentally and physically. Every day people find themselves in the ER after abusing some type of drug, and at IU Health, there's a team of people on standby ready to talk to one of those people in 13 ERs across Indiana.
Hourly, probably by the minute. So we are seeing on average probably 5 to 10 patients a day, but we know that there's still a large number of patients that we could engage with.
The program started up a year ago as a way to get patients connected with the resources that they need to get help. While any doctor could give them that information, everyone on the peer recovery team is a recovering addict themselves.
We really take the time to connect with them, let them know, I was a person that was reoccurring in the emergency rooms. Some of our coaches have been in some of those same emergency rooms. I myself am not only recovering from substance use disorder, but I'm recovering from an eating disorder, self-harm, and have survived several suicide attempts myself. Got sober, and I'll have 2.5 years sober on the 25th of this month, actually.
Having spoken to 800 patients in a year, not every person's going to take the advice, but there's personal stakes in every single conversation.
Because it just makes me feel good about being able to help somebody else and to get them the help that they need, honestly.
Even if one person gets the help they need, the peer recovery team counts that as a success. And after having their first one-year check-in, they're feeling pretty good.
That person actually reported to be in long-term recovery and, kind of specifically said that it was a huge help to speak to us in the emergency room, and then also our follow-up calls were a huge driving factor and supportive in his recovery. So I would say that in and of itself, that one patient that reports that, it pretty much defines the success of the whole program. But I can be biased in that too.
Now, coaches say before you even have to talk to them, you should ask for help if you can. You can call 211 to find the type of hotline that you need, visit an emergency room, or just talk to a trusted loved one who can help. I'm Travis Robinson, Wish TV News 8.